All right, I'm happy to be introducing Sharon Gavison. Dr. Gavison is an IIWCC trained physical therapist and the affiliate scientist in pressure injury and home care research at Kite Toronto Rehab University Health Network. Her research is focused on the development and evaluation of tools and technologies to support individuals at risk of developing pressure injuries and the caregivers who support them. The interdisciplinary research combines engineering, computer science, and healthcare and takes place in the community, in rehabilitation settings, and in complex continuing care environments. Dr. Gavison uses both quantitative and qualitative methods and approaches while engaging patients, families, caregivers, and the community throughout the research cycle. Through this research, the hope is to equip individuals at risk of developing pressure injuries and the caregivers who support them with tools and technologies in order to reduce unnecessary pain and suffering. And with that, I'd like to introduce Dr. Sharon Gavison to the stage.
So thank you so much for inviting me today to come and present in their own voices, addressing the challenges related to pressure injury care. So as you know, my name is Sharon Gavison. I'm an affiliate scientist here at the Kite Research Institute, and I'm also an assistant professor in the Department of Physical Therapy at the University of Toronto. So I've been given permission to share this, and Dr. Ho has also shared some of this information, but I'd like you to meet Bob. Bob was a 77-year-old active male, a weekly bowler, retired sales executive, avid golfer, and handyman. And he's shown here with his three daughters, Sharon on the right, Linda in the middle, and Patty on the left. In November 2018, Bob fell down a set of stairs while at home, and he sustained a brain injury. He was admitted to a hospital, and three daughters, they took shifts at his bedside for months, holding his hand every single day. And although he couldn't speak, he started showing signs of improvement. But in February 2019, a couple of months later, this family, his progress stalled, and the family couldn't really figure out why. And on April 21st, 2019, he was transferred to another hospital to undergo brain surgery, and at which time the doctors discovered an unstageable coccygeal pressure injury and sepsis, and his surgery was subsequently canceled. Sorry, one second. So Mr. Wilson's children, Bob Wilson, his children said we had no idea that this demon was brewing behind him. He was basically rotting alive. He was admitted to palliative care, and he passed away on June 8th, 2019. And according to the hospital, they called it a big miscommunication breakdown on all levels. And I'm sorry, Carol McAnuff, for making you more sad today. But this is a true story. And really, how did this happen? How could something like this happen in a first-class country that delivers first-class medical care? And how is it that a family did not know that their loved one had such a severe pressure injury when they were with him every single day holding his hand? Even more importantly is, why did this happen? And how do we as healthcare professionals, hospital administrators, policymakers allow this to happen over and over and over and over and over and over again? This isn't just confined to Ontario. This is happening across the country. And my intent here today is not to lay blame or attribute this to any one person or any one organization or any one province. But we really do need to acknowledge that we really are a nation under pressure. And I also believe that a pathway towards a solution is to listen to those with lived experience. And these individuals may help guide us towards reasonable actions that we can take. We need to figure out the what. What are we going to do to improve the lives of individuals living with pressure injuries and their families? We need to listen to those with lived experience and come together and develop a holistic and integrated approach into how pressure injuries are managed in this country. So individuals such as Bob Wilson, Ken O'Leary, Norman Munier, Georgina Dodds, Chrissy Dunnington, and the so many other individuals who have died from these injuries in Canada. So much of my work relates to understanding the experiences of individuals living with pressure injuries. And my hope is that through a collaborative and shared common understanding, we can co-design solutions together. So we've sought to explore the experiences of individuals living with pressure injuries and caregivers who provide support. And this study was funded by a Wounds Canada grant. So I'd like to acknowledge Wounds Canada at this time. We interviewed 16 individuals with a current or past pressure injury, 12 caregivers providing care for individuals with a current or past pressure injuries, and 17 healthcare professionals providing care to individuals with a current or past pressure injury. And we found that individuals received information regarding pressure injuries, contributing to their knowledge of pressure injuries. And participants in the study reported receiving information from a variety of sources, including receiving information from their peers, receiving pamphlets, receiving advice and guidance from their healthcare professional, looking online as well, and watching healthcare professionals performing care for their pressure injuries. So just to remember that many of these individuals are learning as they're watching. And this information they gathered really helped to form their knowledge and what it is they knew about pressure injuries. There were also a number of factors that individuals considered that were considered in terms of how they access that information. They reported that the information had to be credible, it had to come from a credible source, it had to be accessible, it had to be convenient, it had to be presented properly. And also it was important that they receive the information in a timely manner. And many of this information helped to guide their behavior. So some individuals reported having received information too early was not at the right time. And having received it when it was happening was not at the right time. So there really was no consensus of when the best time to provide the information other than to provide it ongoing. So some of the things that individuals said were, I've had it prior and it doesn't seem to be as important when you're not dealing with stuff. Unless you get it, you really put it aside. You don't really retain it very much. Other individuals, another individual, another care recipient said, I don't really need to know this information before it happens because I do know what I'm supposed to do. But the fact that this one happened and I didn't know what to do at all, I think that's when I needed the information. So there is some agreement that people need information on an ongoing basis. There are a wide range of emotions that individuals expressed when learning that they had a pressure injury. Some of these emotions range from feeling sad or even feeling grateful that someone, such as their caregiver, discovered the pressure injury. Some of them were surprised and even angry that they got a pressure injury. Many of these emotions were experienced concurrently and not in isolation. Some respondents reported that they were concerned about not being able to see their own pressure injury and to monitor if it was getting worse or getting better. And they also reported on how socially isolating it felt to have a pressure injury. For example, one participant said, I feel like I'm in jail because I need to spend all my time in bed. So there were a wide range of emotions. One individual said, I started crying. So I'm like, and they were very angry. What am I supposed to do now? Am I going to stay on my side for the rest of my life? Like, how long is this going to take this leap to heal? And because you're laying there 3 to 4 days a week and it's not getting any better, you really don't know when at the end is coming and when you're going to see the light of day again. And it's the fact that I have to start over, building new tissue up again. And it's not an easy process because you need to be in a good state of mind. You need to just have an overall good outlook for these and for everything to come together and work properly. And well, at the time I didn't feel it, but thank goodness my caregiver who noticed it. So many range of emotions. And once learning an individual has had a pressure injury, they would engage in different behaviors to help related to the pressure injury, whether the behavior was to advocate for themselves or advocate for proper care, engaging in preventative or management strategies so they would not get any new pressure injuries, or they also to engage in management strategies in order to allow their pressure injury to heal. So I don't think that necessarily, and this is I'm not blaming anybody, this is what people said, but I don't think they necessarily follow or understand the care plan or whatever as clearly as it would, or they'd make a change. And I didn't necessarily have faith in the change that they were doing. Basically, you really need to be on top of them and still question them all the time. They're necessarily not trusting their healthcare providers. And so when they come, I'm kind of telling them what they need to do and everything like that, because I'd rather keep it consistent, because one nurse, and I'm sorry, this is not about any nurses, like, so please, like, don't, because one nurse can throw everything out of order. It's not the same if it's not the same way. So in summary, pressure injury knowledge was acquired through a variety of sources. There were many factors considered when accessing this information that contributed to their knowledge. And once experiencing a pressure injury, individuals experience a wide range of emotions, which then help to guide them in their specific behaviors, including advocating for themselves and engaging in preventative and management strategies. Additionally, participants in the study reflected on what they knew and what they wish they had known prior to experiencing a pressure injury. We also interviewed caregivers, and they shared with us where they acquired knowledge from, what they knew about pressure injuries, and the timing of when they wanted the information. So caregivers received information from a variety of sometimes overlapping sources, including healthcare professionals, the internet, friends, and from prior experience. Some caregivers said they learned primarily through observation of their healthcare practitioner performing care on their loved one. Caregivers also had a basic understanding of the causes, complications, and management of pressure injuries. And from their experience assisting those with the current or previous pressure injuries, many caregivers recognized that immobility was a key cause of pressure injuries and described the importance of offloading or repositioning high-risk areas as a preventative and management strategy. And the majority of caregivers wish they had known about pressure injuries before their occurrence, and in order so that they could prevent them. However, some reported that they wanted to get the information at the time that the individual, their loved one, had a pressure injury. We also interviewed healthcare professionals. So we tried to really encapsulate a more holistic perspective. And healthcare professionals identified challenges and facilitators related to pressure injury prevention and management. And these challenges included patient factors, whether or not they were ready for change, to adhere to offloading recommendations, to engage in self-management behaviors, and also address the fact that there was an emotional toll of having a pressure injury. They also recognized that there were knowledge gaps among healthcare professionals in providing prevention and management strategies. And there were also health system factors as well, including a lack of interprofessional staffing and a lack of funding. They highlighted some facilitators, including a circle of support and tailoring the pressure injury education and care to the style and the needs of the individual. And they had some concrete recommendations, such as specific content that individuals with pressure injuries would benefit from learning about, and also the need for easier to access pressure injury information and an earlier delivery of pressure injury information to optimize the care and prevention of pressure injuries. And it has come increasingly apparent to me in the work that I do and in speaking with individuals with lived experience that we can no longer consider a siloed approach in how pressure injuries are navigated within each of the ecosystems that an individual lives or receives care, whether we focus on pressure injury prevention or pressure injury management. And the social ecological model is a conceptual framework that shows how an individual's health and well-being are influenced by a variety of factors. And this model was initially developed by Bronfenbrenner in 1970s and adapted later. And we can borrow the work from the socio-ecological model to look at the relationships between the individual and their surroundings. The individual could be the person with a pressure injury. It could be the caregiver who's providing support for the individual with the pressure injury, and also even the healthcare professionals who work with the individuals with the pressure injury. So one such factor is the individual who is either living with a pressure injury or providing care to an individual with a pressure injury. So the individual's knowledge, attitudes, and contextual factors, such as their demographics, their race, their ethnicity, their health literacy, they may all influence how they navigate living or caring with the pressure injury. Additionally, the individual's relationships, including their interactions with healthcare professionals, that's their support systems, such as their family members, co-workers, and friends, and their social networks may also influence how they navigate living with or caring for a pressure injury. And their navigation within a healthcare organization and navigating the rules and the regulations may impact how they experience the pressure injury and the care that they are provided with. And the relationship among all the organizations within the community and how that individual may interact with their community may influence how an individual or their caregiver may navigate their pressure injury or the pressure injury of the individual they are caring for. So there may be laws as well, policy at the local, at the provincial, at the national, and the global level that influence how an individual experiences a pressure injury. So in summary, the social ecological model recognizes that there are multiple relationships between the individual, the social network, the organizations they interact with, their community and their policy, the community and the policy. And it also recognizes that the environment is comprised of multiple components or levels, and factors at one level can actually influence factors at another level. And so preventing and managing pressure injuries really requires us to take action at multiple levels simultaneously. We can't just think about a siloed approach. And now, what if we were to use this approach in how we understand a person's experience with pressure injuries and find solutions? So a group of us across Canada, in partnership with Praxis and SWOC and CPIP, are working towards understanding the experiences of persons affected by pressure injuries in Canada. And we seek to achieve consensus as to what the experiences are of those living with pressure injuries and their caregivers. So we've asked individuals what their challenges are with living or caring for a pressure injury, what their pressure injury, challenges of caring for someone with a pressure injury and living with a pressure injury. What are some of the facilitators are for pressure injury prevention and management? So I'm going to put a plug in here. We're still recruiting if you're interested. So we have so far recruited 17 individuals from mainly 2 provinces across Canada, primarily in Alberta, Ontario. 7 of the individuals are healthcare professionals or health system administrators, 4 are care recipients, and 6 are caregivers. And did I mention we're still recruiting? And most of the individuals are female. And so if we were to examine what individuals are saying about their challenges and living with or caring for somebody with a pressure injury, they've identified that there's an emotional aspect of living with a pressure injury. They've talked about exhaustion, frustration, hopelessness, accepting their own mortality, being impatient. And I'm going to say something that I'm sure Carol is going to be very upset hearing. So I do apologize, Carol, again. And this is really hard to read. During the 3 or 4 years of having a pressure sore, there was a period of 3 or 4 months during the time where I had looked at everything and I was perfectly comfortable with the idea of mortality. I was ready. I'd had enough. I was tired physically, mentally, emotionally exhausted. I was just comfortable with the idea that if it was my time to go, it was my time to go. Very hard to hear. It's very hard for me to read that, by the way. Individuals also commented on their challenges and the personal impact that pressure injuries had on their own life, on employment, on quality of life, on recreation, on activities of daily living. And everything's so kind of timed. They talked about everything had to be timed and timed to the minute. There was no spontaneity, and everything's so kind of timed and controlled, and it takes spontaneity out of being just able to live life. And I've had to rearrange things in my life that I enjoy doing, and I'm still doing it to this day to make sure I never experience it again. And someone talked about how traveling was, even though they were traveling, it really wasn't a holiday. It's not a vacation when you have to do wound care and personal care. Individuals also acknowledged that there was a lack of awareness of knowledge related to pressure injuries, including the causes or risk factors, skin inspection, and the importance of equipment for pressure injury prevention and management. So healthcare professionals commented, one of the things that was absent was a ROHO cushion, which a family didn't realize how important that was. One piece of equipment was to prevent pressure injury. So it developed and really impacted their life. And the majority of people that I work with don't even know why these things happen. So that was something that was commented by healthcare professionals. And healthcare professionals also commented on the financial implications or the financial restrictions and how that impacted on pressure injury care. So not everything is funded for people. So if they need a specialized mattress, which just one individual did, it had to come out of his pocket. And so he wasn't sure that he was willing to do that. So if you don't have the resources, how do you treat it? So individuals spoke about challenges of having a pressure injury in relationship to the interpersonal relationships that they had with the care recipient or caregiver or with the healthcare professionals. So when they're talking about the relationship between caregivers or care recipients and healthcare professionals, they talked about assumptions were being made. There was discord. There was some judgment and stigma about having a pressure injury, like it's your fault that this pressure injury occurred. So a lot of information that we provide and that would be available on the internet, but sometimes you're making assumptions about people's, like, did they have a computer and what's the literacy level and their ability to have that? And there's a lot of discord between patients and their caregivers. You see a lot of like, you need to do this, you need to offload, you need to, but that might not be what they want to do for their quality of life. And I see people nodding in the head, and I guess they resonate with this information that I'm saying. And there was also challenges with the interpersonal relationships between the care recipients and the caregivers. One participant said, I'm more of a nurse to him, caregiver, than a wife. It's not the life I wanted. And you know, he's got a very short fuse. It is frustrating doing this for the last 6 years. And just so you know, it says your computer is about to restart. I really hope it doesn't restart. I'm going to snooze it.
Yeah, do you mind snoozing it?
Yeah.
We
Okay.
have 7 hours anyways.
Okay. All right.
Thank you.
Sorry, a little bit of levity here. So individuals also spoke about the challenges related to the organizations that they may use when accessing care for pressure injuries. So they talked about the organizational lack of knowledge or training of healthcare professionals who are providing pressure injury care. And when I talk about organizations, I don't just mean hospitals, I mean home care as well, out in the community. So people in my area, they're able to identify pressure injury, but they're still struggling in terms of differentiated between moisture or staging it with a standardized system. And then one caregiver spoke about her experience about when the vac fell off, the suction fell off, and there was nobody who could come and put it back on. And there's no suction. And what happens then? I'm hands off. Who do I call? I call nursing. And nursing is going to come. They're not a wound nurse. They're not trained for this. So lots of frustration. And also there was a lack of accountability and the lack of priority for pressure injury prevention within the organizations. And we've heard a lot of this already this morning. We're hearing the same thing over and over again. And just so we all understand that it's not just us that's saying this, but people who are living it or on the ground and experiencing this are also recognizing this. So this is a very troubling quote on the bottom. It's not like we think about hand washing, I'm talking about accountability or falls prevention. And when a pressure injury does happen, it's kind of normalized. You could compare it to like if I did a med error, I'd be like, oh, bleep, I made a med error, and that would sit with me for probably the rest of my career. But a patient developed a pressure injury, I'd be okay, time for lunch. And not to say that that was their attitude. That was not their attitude, but that was their perspective on the attitude about individuals developing pressure injuries. It's so normalized, and it is a silent pandemic. So they're wanting to keep you alive. Are they concentrating on wounds? No. So it's just in terms of the lack of priority for pressure injury prevention. Individuals also recognized that there were gaps in care. There were many reactive rather than proactive strategies for pressure injury prevention, prioritizing other care over pressure injury care, and being too prescriptive. So the one care recipient said they just treat the symptoms. They don't really bother with the root cause. And one healthcare professional said, we do risk assessments. Sure, we do them, kind of check them off, but I would argue that perhaps they're not being completed accurately. So troubling, huh? Really, really troubling. And then they talked about the lack of staffing or issues related to staffing. So not having enough staff or specialists available, not having enough knowledgeable staff, having staff who are overwhelmed and unreliable as well. And so you can't give me, so one individual needed help with offloading their loved one. You can't even give me 2 hours every other day for wound care and personal care. And there's no specialized care or scenario where somebody says, oh, this is a pressure sore. We know what we got to do to get finite resolution of solving it. So the last thing is people spoke about challenge, or second last thing is people talked about challenges in navigating their pressure injury in the community. And they talked about the health system was so complex to navigate, and navigating the healthcare system, it can be complex. People still have to figure out how to get home care if they aren't on home care. And the last thing is, an individual has described how existing infrastructures or policies were challenging for individuals in accessing pressure injury care. So and one individual spoke about the fact that the care was for profit or it became privatized. And our healthcare system is going way full of profit healthcare. That's not a way to treat humanity. They're just trying to make a buck when in reality, they're supposed to be saving people's lives. Everything has become privatized across the country. So now I've spent a lot of time talking about all the challenges that individuals living with pressure injuries experienced, and we can find many of our answers and what we can do by learning about some of the facilitators that help with pressure injury prevention and management across the country, according to the social ecological model. And these are recommendations. I'm going to be giving you a list of recommendations, and these are recommendations coming from their own voices. They're not based on RNAO best practice guidelines. These are coming from the heart of people who've actually spoken about their experiences. So some of the facilitators related to knowledge or education about pressure injuries in terms of learning about the causes, offloading, complications, and prevention. People commented on how knowing about pressure injuries helped them in the future for not getting another one. And they also talk about, if I was less ignorant to what was going on in my life during that time, I honestly probably would not have developed the pressure sore, the injury, and I wouldn't have had to deal with 3 years that I did. So recommendation 1, from their own voices, provide pressure injury education to patients and their essential care partners throughout their journey. So don't stop when they're at risk. Don't stop when they get one. Deliver pressure injury education on an ongoing basis. Individuals talked about facilitators related to prevention and management of pressure injuries, and they talked about frequent repositioning, appropriate equipment, skin inspection, infection management. So it's important to check their body to make sure that we're in areas that they can't see. That was spoken by a caregiver. And they also talk, and this was a healthcare professional speaking about their own experience with their mother, but they talked about, recognizing that their mother was frequently repositioned. So recommendation number 2, from their own voices, encourage clients and their essential care partners to engage in regular pressure injury preventative practices. There were also other factors that helped facilitate or help individuals manage their pressure injury. And these included having a support system. So caregiver was talking about a healthcare professional who gave me her phone number and says, text me anytime. If you have any questions, we can FaceTime, which is great. Not saying that everybody needs to give their phone number, but having that access. Some individuals have actually, in previous work, have expressed they wanted a 1-800 number to call if they had a question about their pressure injury or developing pressure injury. And an individual commented on a care recipient commented on having the support system in their life. I had my fiance with me through it all, and I was still living at home with my mom. So I had that support in a sense. So recommendation number 3 in their own voices, facilitate where possible, proper supports for clients and their essential care partners as it relates to pressure, injury prevention, and management. There were organizational facilitators that were also identified related to pressure, injury prevention, and management, and these included knowledge and training of healthcare professionals. And it also, so recommendation 4, and I'm not just going to keep going through all the quotes, but, ensure proper training of staff. And this is staff from any frontline staff as it relates to pressure, injury prevention, and management, including knowledge of resources and referrals, because they wanted to know where to go and get additional help. The attitudes, facilitators that were reported were a culture that prioritized care, a patient-centered care, supporting healthcare professionals to make decisions, and characteristics of the healthcare professionals. So recommendation number 5 in their own voices, ensure an organizational culture that is client-centered and prioritize pressure, injury prevention, and management. And I feel like I'm speaking to the converted anyway, so, and then the other facilitators were practices related to pressure, injury prevention, and management. So assessments, utilizing a holistic approach, having a wound care team, and optimizing communication. So recommendation number 6 in their own words, ensure a wound care team that provides a holistic approach for the prevention and management of pressure injuries. And staffing was also an issue. So having the clinical expertise of staffing helped for the prevention and management of pressure injuries. And as one healthcare professional said, we have a good clinical expertise in managing wounds, a very comprehensive wound program for our nurses. We always have that extra expertise to draw on. We have people that have additional specialized training and surfaces, good expertise across our program of different people who are really specialized in what we do. So we can draw on those resources. So recommendation number 7, ensure appropriate clinical expertise as it relates to pressure, injury prevention, and management. So there were community facilitators, and these included accessibility of interventions and equipment. So anyone can call in. So they're talking about home care, being able to access home care readily. So anybody can call in. We would phone the neighbor and do a quick intake if that's what they want. And also advocacy and advocates and wound champions. And I kind of put them separately because I think there's patient advocates or client advocates and essential care partner advocates, which is different than a wound champion, I think. But they talked about, you got people who just keep at it and keep saying, we need this, a position system, or you're not going to pay for it. Well, you still need that. So to support advocates or champions, just keeping at it and keep bringing information forward and these bad stories and saying, here's a solution, here's a gap. So recommendations 8 and 9, ensure easy access to equipment and services and promote pressure injury advocates and wound care champions. And there was another recommendation or facilitator related to a successful pressure injury prevention and management, and these were accreditation requirements as a driver. So accreditation and required organizational practices, this is a great little lever to be getting people to act. And unfortunately, people don't act until they see something like that. And so why not use that as a driver, right? So recommendation 10, and I know that there's already accreditation standards. So implement accreditation standards for pressure injury prevention and management. So pressure injury management really takes a team approach. And there's a famous African proverb that I've heard one of my colleagues use, and I've kind of stolen that idea from her. So in full disclosure, if you want to go fast, go alone. If you want to go far, go together. And the only way you'll truly be able to address this nation under pressure is to go together. So thank you.
Thank you so much, Dr. Gabison, for delivering such a powerful message, for highlighting the importance of listening, not only listening, but actively listening to the voices of persons with lived experience of a pressure injury, their families, their caregivers, and to tailor the care and management of their plans of care and needs to themselves. And thanks for reminding us that we are also not just here to manage a person's wound, but we're actually managing a person. and that we have to make sure that we have that humanity to give the holistic type of care that the patients and their families and the population that we serve are given its holistic lead and plan of care. So at this moment in time, given in the interest of time, we will only ask, allow one question for Dr. Abison.
Speechless.
I
Okay.
think everybody are reflecting right now.
What strategy would you recommend to share the new accreditation ROP for skin integrity with the public?
Well, I think the frontline staff need to probably know about it. Frontline individuals need to know about it and share it with everybody that they interact with on an ongoing basis. I mean, that's, I think, the first line. I think that an informed person is a person who can make informed choices and decisions. And having those, knowing about those standards are probably going to be very helpful to help guide individuals in making informed choices.